Last summer, an outbreak of hepatitis A caused 11 restaurants to be shut down. A previous outbreak in 2015 sickened hundreds of people, with many needing to be hospitalized. In both cases, we know that the source was tainted seafood, but most people don't understand the disease itself. Dr. Marc Shlachter from Castle Health Clinic of Living808 is here to help us understand hepatitis A and what we can do to protect ourselves against it. Mr. Shlachter, Dr. Shlachter, thank you for joining us.
John, thank you for having me.
What is hepatitis A?
Well, hepatitis A is a virus, and you know there's viruses that cause the flus and common colds, even skin warts. This virus attacks the liver. There's actually hepatitis A, B, C, D, and E, but the most common in the world is hepatitis A, and it's extremely infectious.
Well, I know that a lot of people at the Adventist Health Castle were vaccinated. Vaccinations were going out. How long did the vaccinations work for?
Okay, well, the first vaccination probably will last well over a year. But for a lifetime immunity, you'll need a booster, and the best time to get the booster is 6 months to a year after the first shot. However, if it's been more than that, I would still get the second vaccine.
How is it spread? And then how many or what precautions should people take? How is it spread, and what are the precautions that we should take?
Okay, hepatitis A is caused by contaminated food with the virus, and it could be like seafood that was kept in contaminated ice, not actually the living fish, but once the fish has been commercialized and soaked in ice water, contaminated food. It originated from human sources that have had the hepatitis A, and this could be, spread to the food.
What should you do if you think you have hepatitis A, and then really how is it treated?
Okay. Well, if you've been exposed to hepatitis A, and the exposure takes 2 to 6 weeks before you get sick, and if you're sick, it starts with nausea, vomiting, malaise, your eyes start turning yellow, and hopefully, by then you'll be seeing a physician. There's no real treatment for hepatitis A, and just take care of yourself, rest, and proper diet. There is rare instances of hepatic failure. That's liver failure.
Okay. And
some people can die with a fulminant course of hepatitis A. And those people need a liver transplant.
Wow.
But it's uncommon. Most people get a complete recovery, and then they're immune for the rest of their lives.
So very serious, but some of the most common symptoms are a lot like the flu, I guess.
Like the flu, but different from the flu, your eyes will start turning yellow.
Oh, okay.
And
so that's a big telltale.
Yeah,
okay.
Right.
How do you get vaccinations? How do you get those?
Well, you could go to any pharmacy in the state of Hawaii and just ask for a hepatitis A vaccine. However, if you want your insurance to cover it, half of our medical insurances require a doctor's prescription. So you'll need to see your primary care doctor. If you do not have a primary care doctor, you could call Castle Medical Center and let them know where you live, and they can find a doctor in your area to write you a prescription. But if you have no insurance, you can certainly just go on your own and ask for it if you're over 18. If you're under 18, you have to see a doctor.
Thank you so much. I'm seeing you, and that's good enough for me, and I appreciate you answering all our questions, because I know that our viewers, this is a scary thing. I mean, you want to get it treated, you want to take care of yourself, you want to prevent it, and I appreciate you answering all our questions. Dr. Shlachter, thank you so much for joining us on Living808.